About 10% of American men and women have fertility issues that can prevent conceiving a child. And for U.S. soldiers facing those issues, deployment for duty can complicate the timing of fertility treatments. But the Texas Fertility Center has a solution and won't take no for an answer. It works with hundreds of military families, waiving fees and using the very latest medical techniques to help produce healthy babies. You want proof? Meet Axel. Axel is the 20-month-old pride and joy of James and Brandy Bryan. He came along after years of trying and 5 miscarriages.
How many surgeries I had in 1 year, kind of that topic and things, I was just emotional. There's really no words to describe how you feel. I mean, when all this happens, you're emotionally distraught.
There we go.
I mean, I wanted to have a baby too, but I wanted to have a baby for him too, and then, you know, it's like you feel like a failure, I guess, in a way. It's a really terrible feeling.
The military services provide aid to families for adoption, but not fertility treatment. But at the Texas Fertility Center, military families get VIP treatment.
Respect. You know, the issue is that they are brave enough to go out and take care of business so that those of us who are not quite so brave can stay at home and work and take care of patients.
Sudden deployments can disrupt treatment schedules, something the center has learned to work around.
What if, God forbid, they don't come back? Or what if they're gone for an extended period of time? Or what if their spouse has a condition that we've been able to fix and now is their most fertile time and they find out that they're getting deployed? What can we do about that?
The center can freeze sperm and eggs. Eggs are the trickiest, but the center uses a new flash freezing technique that ups the odds.
We're the most successful program in Texas at not only freezing eggs, but thawing them and having babies born from eggs that we've frozen. And we can freeze embryos.
Infertility can be traced to any number of complications. The trick to treatment is a flexible approach.
We individualize everything for everybody every single time.
In Brandy's 5th miscarriage, Axel's embryo survived. His twin did not. But it was enough for the clinic to develop an in vitro pregnancy. Dr. Silverberg waived his fee. Now James and Brandy have Axel, who's become a toddling musician.
That is his routine. Every morning he gets up and he goes and plays his drums every morning.
A little drum racket, a welcome thing.
I don't know, but when we look at him, it's worth the wait.
And now, after 20 months of parenting, is it all they hoped it would be?
More so, because even the nights that he would cry, it was like we'd smile at each other because that was like a sound that we were afraid we would never hear.
A sergeant first class with nearly 20 years of service, James will ship out on his 3rd deployment next year.
Ready,
For now, he's enjoying every moment with Axel.
He's our little miracle, definitely.